injections or shots that the dogs should have. They can get the parvovirus shot as early as 5 weeks. At 6 to 9, they get the DHLP-P shot, which is distemper, hepatitis, leptospirosis, parainfluenza, and parvo combination antivirus injection. That's at 6 to 9, around 12 weeks. They can have the first rabies shot. Then around 12 to 15 weeks, they get another DHLP-P booster shot. Then they get adult yearly shots, the DHLP-P, and Bordetella is also recommended, especially if they're in like daycare. That's every 6 months to yearly, depending on the boarding requirements, but yearly boosters are recommended for that as well. And the rabies is every 1 to 2 years, depending on the type of shot that they get. So parasites that they could get, obviously they could get ticks, which can be removed using a pair of tweezers or a credit card. Just swipe it. He's actually on Frontline Plus and Sentinel to help prevent these. He did actually get a tick in his ear one time, and it was very shriveled up. And I asked the vet about it, and he said that those medicines don't actually prevent the ticks. They keep them from actually feeding on the dog, sort of, and they kind of wither up and die. So we actually found it the next day after he had been playing around in some reeds and stuff. So if we go out anywhere like that, I actually try to check, not just his body, but his ears and, like you say, his feet and legs and underneath for those kind of things. Fleas and ticks, like I say, he's on the Sentinel and Frontline Plus to prevent those. He's on, that's also the Sentinel a heartworm preventative. It also prevents things like hookworm and whipworm. Those kind of things can cause diarrhea and intestinal problems. And ear mites, they can get ear mites, which can be prevented by, cleaning the ears and keeping that clean. Alright, proper nutrition for Jasper. He eats half of his food as Science Diet, the other half Blue Buffalo Basics, which is a hypoallergenic food. He takes 4 cups a day, half and half. We came up with this kind of with our vet because he has a bit of a sensitive stomach. He can't have anything that has a lamb or liver mixture in it. He doesn't do well with that. He gets diarrhea. Things that dogs shouldn't eat would be grapes or raisins, mushrooms, houseplants, chocolate, alcohol, anything with caffeine, onions, garlic, those kinds of things. That's it. So he likes the rake. It's part of his dog grooming. He doesn't really need to be clipped because he doesn't get long hair. I do trim his nails, but he doesn't really get long hair between his foot pads. If he did, that would need to be trimmed because it can build up ice and mud in there and be really uncomfortable. I do check to make sure there's no stickers that he gets stuck in between the pads of his feet, especially when we go out messing around. I do check just to make sure there's nothing stuck in there. But other than that, you could just trim it a little bit. It also, if they get long hair around their paws and between the foot pads, it can give them less traction. So trimming that can also give them a little more traction. Good boy. So I'm going to demonstrate how you would clean the dog's ears. He did have, when he was a puppy, he had an ear infection, so we had to clean his ears. They gave us this ear wash solution, and how you do that is to kind of pull the ear up, and then you would fill the cup with your solution, and use your cotton ball to kind of wipe the area here, and make sure you get out you know, any particles there. You don't want to go too deep into the ear. You just kind of want to, you know, wipe the area clean. They say to squash it around in there. Then we had to do some antibiotics, and you would do this the same way. Put your head down. Pull up the ear and drip this down into the ear, and then we would kind of squish that around. I did have some eye wash here available just in case. Extra cotton balls to make sure it doesn't, you know, get into his eye. But I did have the eye wash solution available just in case it did get into his eye. Then we would rinse the eye, and you know, you could just wipe if he gets any goobers or anything in his eye. You just lightly wipe it off, and he tolerates all this pretty well. Yeah, I know there's nothing on there. Yeah. All right.
So we do a couple of things for Jasper's oral health. He just had he just actually had his teeth cleaned, and so there's a little spot where they put in the IV. So he's at 2 years, and you're supposed to get their teeth cleaned and have them do sedation every couple of years. But we basically started using this dog toothpaste, and our vet recommends that we actually brush his teeth 3 times a week. And so we normally do it like Monday, Wednesday, and Friday. And then the other thing is they recommended this, which is like a chlorhexidine rinse for dogs. And for this one, it's really easy. You just kind of lift up their gums, there you go, and then squirt it in there, trying to avoid touching the actual gum line with the tip of itself, so that you're not damaging it. And you basically do this once or twice a day after meals. It's pretty easy. So for the days that are not Monday, Wednesday, Friday, this is what we'll actually use on him. He tolerates it fine. The other days of the week, we actually got a toothbrush for him. We used to actually use a dog toothbrush, and then our vet recommended this, and we've been trying to get used to it now. So there you go. Yes. So we'll spend a few minutes doing this on those days. Yes. Good. He struggles with the front teeth actually the most. I think it must tickle more or something. Yes, good boy. And his reward is the toothpaste, which is poultry flavor. Alright, last one. One more. Yes, good boy. And that pretty much is his oral health.
Okay, for the anal sacs, you're going to raise the dog's tail above his back. The anal sacs are positioned at the 5 and 7 o'clock positions. To express them, you would milk upwards in a C motion. They're little P's underneath the skin. The fluid will be very smelly, so wear gloves and proper clothing. It should be a brown liquid. If it's yellow or milky, the dog may have an infection, so you would need to take it to the vet. Stay in your prayer. Have a foot. So I'm going to demonstrate me handling his head and muzzle and ears and all that kind of good stuff, and he tolerates all this really well. Go to sleep. Yeah, go to sleep. Good boy. So I can check his ears, that kind of thing, to make sure that I don't see any infection. To check capillary refill time, I'm going to push on his gum.
Yeah. Alright, let's do this. Okay. Yeah. Don't that feel good? That feels good right there, don't it? Oh, look at that. Ooh, yeah. Yeah. Feels good, huh? Oh, excuse me, I went on your tail. Okay. Lay down. Lay down. My fault. My fault. Come on, lay down. I can't believe you breathing good right there. Good boy. Yeah. Yeah.
This is my dad brushing Jasper.
Yeah.
Alright, Jasper will allow me to look into his mouth without any problem. Hang on, buddy. He doesn't really like it, but he'll allow me to do it.